Welcome, everyone. In this episode, we are going to talk about measurement of sedentary behavior and physical activity in children, activity levels and mental health of boys and girls during lockdown, how to do large-scale study completely remote, and other interesting and relevant topics. And we have a great guest for today's episode. Our guest has completed her PhD in Liverpool John Moores University and is currently working in Swansea University. Ladies and gentlemen, please welcome our guest, Dr. Liezel Hurter. Welcome, Liezel.
Thank you. Thanks, Ollie. Thanks for having me. I really appreciate being on. And yeah, I feel quite honored to be included in your podcast.
No, it's really nice to have you. It's my honor. So, would you like to introduce yourself in the beginning?
Yeah, sure, of course. So I grew up in South Africa and I did my undergraduate studies and my master's degree at Stellenbosch University before I worked for a couple of years at the University of the Western Cape, where I taught and just very general sports science related modules before we started our family, and I took an extended career break at the time to raise our small children. Before in 2016 we moved to the UK, as you said, to Liverpool, so that I could do my PhD there. This was now, of course, me, myself, my husband, and our 4 children. So I did my PhD under Dr. Lynn Boddy, and the focus was on measuring children's sedentary behaviors as accurately as possible. And yes, I finished that just before that first national lockdown that we had in the UK in March last year. And now I'm currently at Swansea University, as you said, doing a postdoc, even though I am based in Kent. So I don't live in Wales, but I'm working for Swansea Uni.
Yeah.
So that's basically me. Yeah.
Yeah, that's a good story. And having 4 children, that's probably quite a lot of experience of children. And now you're doing
Yes,
research with them.
I'm really grateful that my career path has ended or has, evolved this way, that I did my PhD while I actually already had my children, because I think, that just I understood the age group really well, because my eldest was the same age group as my participants during my PhD study. So I'm grateful for that. But comes with added challenges.
Yeah, I can see that. Yeah. So what kind of project you are working on at the moment?
Yes, it's a really exciting study. I should perhaps first mention this was first funded by the Welsh government for, the intended time of 6 months that we thought the project would take. But of course, these things don't always work out like you plan, and it's become much bigger and it's taken much longer than anticipated. So after the 6-month funding period expired, the funding and support was taken over by WIPIS, the Welsh Institute of Physical Activity, Health and Sport. So my study now falls under their remit. And it's basically, the aim of the study is to determine the effects of the COVID-19 lockdowns on children's physical activity, but also their mental health and well-being. So with that in mind, of course, it was during lockdown, so it had to be a completely remote study because everyone was confined to their homes, researchers as well. So I recruited via sending emails to all schools in Wales, asking them to send the study information to their parent base, because, of course, with children, you need parental consent. You can't be just an anonymous survey. So the schools sent, or not all schools, but some schools sent the information on, and parents completed a quick consent form, giving me things like, date of birth, postcodes, postal addresses, and very importantly, an email address. So then I sent individualized links to all those email addresses, 4,500 of them, so that children could complete an online survey. And this survey was, it included 3 different questionnaires, validated questionnaires, one for physical activity, the PAC-C, that's physical activity questionnaire for children for primary school, and the PAC-A, adolescents for secondary school children, but also Sterling Wellbeing Scale and the Good Childhood Index. Those two give us um, a score for well-being and a score for life satisfaction. So that was during the January lockdown, and children completed that at around, what was it, 1,700 children completed it. And then I chose a randomized subsample of 800 of those, stratified by age, sex, and socioeconomic status, to wear activity accelerometers on their non-dominant wrist for 7 days. And I posted those to them. After 7 days of wearing them, they posted it back to me. And that was basically the first time point. And then we did a second time point during or just after the Easter break, when all the children were back in school. So we have that comparison. I don't know of another study that was, that used accelerometry to this large scale, um, during the lockdown. I think that was the the most difficult part to plan this all around being in lockdown and being remotely. Yeah. So at the moment we already have 2 different time points, and yeah, it's still continuing. So
Yeah,
that's
yeah,
it in a nutshell, quickly.
yeah. Very, very interesting. Did I understood right that you didn't plan to collect the data from the lockdown, but it just started at the time, so you ended up collecting it?
No, the idea was to well, the idea was to monitor children throughout the different stages of the pandemic,
All right.
and yes, the study started at a time when there was no lockdown. So no, yes, probably you're right. We didn't really plan that it would be in lockdown, but
Hmm.
when data collection time came, a lockdown was announced, and this was the third national lockdown. That was in January. Remember, the previous ones was um, last year. So in a sense, I was grateful, for, obviously not grateful for the pandemic worsening and everything, but that we were able to collect that data
Hmm.
during lockdown. Yeah. So then the next time point was, during school, children were back in school, but there were still some restrictions. So children will most likely have been in class bubbles, and things like your break times would have been staggered, maybe it depends on the schools, but
Hmm.
maybe in a shorter, I mean, in a smaller setting for break times to take place in. Things like that was still a bit different. For the next time point, it would pretty much be back to normal, because we don't have any of those restrictions anymore in the UK at
Hmm.
the moment, despite cases going up. But yeah, that's where we're at.
Yeah, sounds like a really interesting data set. I think a unique data set,
Yeah.
which will probably give us very nice information. So, have you already analyzed the data, or are you just in the collection?
Yes, so I've analyzed the data from the first 2 time points, or at least some of the data. I've analyzed the accelerometer results with, I've briefly looked at the mental health and well-being aspects. I've not looked at um, the physical activity questionnaire,
Hmm.
those results, not just yet. But we also had something like, during the first 2 data sets, I had an open-ended question around, how does lockdown make you feel, and why do you feel this way? And then again, once they were back in school, how do you feel about being back in school, and why do you feel this way? So I have a qualitative expert that is currently analyzing that part of the data set for me, because it's definitely not my comfort zone.
Yeah.
So yeah, we have 2 papers in the process of almost ready for submission, one accelerometry and one the mental health and well-being.
Yeah. And how was the mental health? I think it's a very interesting topic.
Yes, so it's difficult for me to say compared to prior to the pandemic, because again, this isn't really my field. I'm new to it, but I can definitely say that all the mental health and well-being indicators significantly improved once children went back into school. So I think it's safe to assume that the lockdown had a negative effect on their mental health and well-being. Um, Also, interestingly, boys had significantly higher mental health and well-being scores. You know, the well-being score, the life satisfaction score, positive outlook, positive emotional state, things like that were consistently higher for boys than for girls. And the other thing that was quite sad for me to see is you see a very, very definite decline in mental health and well-being indicators as children age. So with your 16 to 18-year-olds scoring the lowest both during lockdown and during school time. So yeah, it's really interesting, and I'm looking forward to monitoring this, in the future, and
Hmm.
continuing the study and see how the trends, how, if it changes over time more so
Hmm.
than it already has.
Yeah, and you have interesting data because you have the sedentary behavior and physical activity, and then the lockdown have made kind of taken away the social parts of life. So you can
Yes.
probably see that how is the social versus sedentary behavior affecting the mental health.
Yeah, yeah. And the sedentary behavior from the accelerometers were also quite sobering, the results. I think the mean across the whole sample um, of those included in the final analysis was 850 minutes per day, which is what, 16 hours. This is a very, very long time. And of course, I mean, this is according to a cut point or a threshold, raw acceleration threshold. So we know that it isn't likely to overestimate sedentary time because,
Hmm.
that accelerometer isn't even analyzing it that way. We're unable to distinguish between postures. So
Hmm.
it's probably including some time spent standing still. But even so, I feel even if it is an overestimation, it is still, very, very high. Even if we take away 2 hours, that is still
Hmm.
very, very high. So that is a concern. As soon as children went back to school, we immediately see that dropping by 90 minutes on average per day.
Hmm.
Um, but no noticeable differences between boys and girls sedentary time. A really, really interesting finding for me was the boys and girls. Typically we see boys being more active than girls, reaching, higher levels of moderate to vigorous physical activity. But the MVPA during lockdown there was no difference between
Hmm.
boys and girls. And I guess we could say then that boys were more affected by the lockdown because, you know their obviously their physical activity levels dropped more so than girls, probably because of the lack of sport participation. We know boys tend to, participate in sports more than girls. But an interesting finding for me also was, despite this lack of maybe I should say this first, as soon as they went back to school, boys' MVPA increased by double the amount compared to girls.
Hmm.
So immediately they recovered that lost, time spent in MVPA more so than girls. But despite that lack of difference in MVPA, I mean, this is again MVPA. It's a cut point, and we desperately want to try and move away from using cut points. So I've also analyzed the data and looking at things like the intensity gradient, average acceleration, and the MX variables. And so no difference between MVPA boys and girls during lockdown. However, boys still had significantly higher intensity gradients. So in other words, a more favorable intensity profile compared to girls. And at first I was intrigued by that, but when I looked at those MX variables, in other words, that variables where we look at the most active 5 minutes, most active 10 minutes of the day, and the value of, for example, MX or M30 would be the minimum uh, acceleration intensity of the most active 30 minutes. So when I looked at those for the lower MX variables, so the most active 5 minutes, 15 minutes, 30 minutes of the day, boys at significantly higher, or they reached significantly higher intensity, acceleration intensities, and that is what makes their intensity gradient, significantly higher than girls.
Mm.
So that was really interesting. Despite them being at home, I wouldn't know whether those accelerations were achieved in the typical, we were allowed to go out for exercise typically once a day. By the time that this data collection took place, it was unlimited exercise. So, but I don't know, we won't know how many times they did go out for exercise. Typically, I think, for the younger age groups, they still had to go with parents. So, yeah, it's a really interesting data set, and I think there's going to come a lot more. We're going to get a lot more out of it. Also, the same with boys and girls. I see the same difference in the age group. So as children age, the um, those lower MX variables, that's where the difference lies. So for your primary school children, they reach much higher intensities, and that goes down and down as they age. I was quite quite oh, what's the word? Sad to see, distraught to see. I don't know, concerned. I was
Mm.
concerned to see the MX values of upper secondary school girls, because it was so low. Even during school time, they did not reach acceleration intensities equivalent of a brisk walk for 30 minutes of the day. So your MX or your M30 was below 200 milligravity units of acceleration per
Mm.
day during school time. So it's a time when you'd assume there'd be maybe some kind of active traveling to school. There would definitely at some point have been a PE class or some sport. All of those were allowed during that second time point. But despite that, physical activity levels stayed really, really low. So I think that is an age group that should really be targeted, if we think intervention wise.
Mm. Yeah, so a lot of interesting data. 16 hours of sedentary time with the
Man,
cut points, and yeah, if you sleep 8 hours, that's only being sedentary whole
the rest of the
day.
time, basically, yes.
Yeah, and then there was difference between boys and girls, and looking at different variables. What kind of advice you would give for people who are doing project with children, that what variables they should look from these? Like you talked about MX intensity gradient. What advice would you give?
Yeah, I think, well, it all depends on what your outcome, what your study's aim is really.
Mm.
Because the intensity gradient, the MX variables, they are really good in giving us more information about the whole activity profile, but they don't tell us anything about sedentary behavior. I mean, they basically, well, that's maybe, yeah, not entirely true, because I mean, if you have a very, very low intensity gradient, it's likely that you're spending a lot of time sedentary. But I'm just thinking, it doesn't tell us time spent sedentary. So it depends on your question, or your research question. But I would definitely recommend trying to move away from cut points. But it is, even for me, it's difficult to do, because we still have the government guidelines, that talks about moderate to vigorous physical activity. So I feel, in a sense, we need to report that, so that our audience is not only researchers who understands these metrics. Yeah, but the good thing is, with if you analyze a data set using R and GGIR, you can easily compute all those metrics, I also say by the touch of a button. You
Mm,
can easily simultaneously get a lot of data out of there, um, and then you basically pick and choose what you need to use for your specific research question. The the problem always with sedentary time is we need to both have posture, and we need to have the energy expenditure if we want to, you know, measure the behavior according to its definition. Um, and then on top of that, you need contextual data as well. So an accelerometer alone doesn't tell you really everything that you need to know. So it's very complex. But I think every study is different.
mm. Yeah, so there's many things to consider when you're choosing the assessment method for
Yeah.
physical activity and sedentary behavior. How did you choose your method, your device for this project?
Yeah, so we are using activities. So first of all, we needed a wrist-worn monitor. Unfortunately, we know from previous studies that maybe a thigh-worn monitor would give us better data, but in children, just from my experience, also children they don't really like the thigh-worn ones. Compliance is unfortunately much better with the wrist-worn. So, and also because it's remote, we couldn't. I mean, I wouldn't have sent blasters and things, for people to attach monitors. So we needed a small wrist-worn device. The activities, one of the consideration was it's a UK-based company, so customer service has really been very good. Um, I've even had once or twice where I needed replacement monitors, and they sent it next day delivery, which was really convenient. But also one of the large surveillance studies in the UK, the biobank study, uses activities, so it's easy for us, from a data comparison point of view, to use activities. Another thing is they are much cheaper than some of the other brands, and of course, sending them by post, we knew we were going to lose some monitors, and we wouldn't want to lose, all our funding money in the process. So that was also convenience why we chose activities, really.
So basically, it came down to wrist-worn device, price, and ability to get raw data, right?
Yeah, yeah,
Yeah.
yeah. The raw data definitely, and the activities. I mean, they've been shown to be, uh, you know, high. They have high equivalency with Genie Active raw data, and so I was happy with that. Also,
Mm,
the fact that they're nice and small, they fit through a letterbox. So that's just a practical
mm.
consideration
And
as well.
and how was the, children have usually quite small wrists. How was the
Yeah, so
fitting? Did you have any experiences on that
Yeah,
front?
so typically, so what I do is I just punch 2 or 3 extra holes in the little
Mm,
wristband, because most of these brands have, one set, or most universities have one set of accelerometers, and that's what they have. That's what you have to use. So I bought a hole puncher, but I think for some of them the activities, it's all kind of like a rubber or a band. Yeah, so you can just use a very sharp knife and put 2 or 3 extra holes in there. But unfortunately for the younger age groups, I still have parents telling me that, sorry, it's just too bulky. He was distracted by it, couldn't sleep with it. So there are some children, the smaller ones, where even activities that are quite small, it is still a bulky,
mm.
device to wear for some children.
Yeah, that's good feedback. We are actually designing for our device
Mm.
wrist strap, and would be nice to hear your opinions. If you could design it freely, how would be the material, color, size? What how would you make a wrist strap?
Yeah, the thing is, as what I found in during my PhD research, children enjoyed the actigraphs more because they have the actual they show the actual time on there. The activities don't do that, which is obviously why they can make them much cheaper. Color wise, oh my goodness. Yeah, I want to say the black is a little bit boring. I would try to do different colors, but or at least I like blue. I would always go with blue, but that's just me. I'm trying to think. Um, uh, in general, I haven't really had a lot of parents saying that these activities are, what is this, basically a silicon wristband. I've had some that say that they've developed a rash, but I had those with Actigraphs as well. I've had those with Genie Actives. I think any child with a sensitive skin, I think any type
Mm,
of material would probably cause that, even though, even with the Tegaderm, those plasters that we used for
yeah,
active bell, they are hypoallergenic. What's the word?
yeah,
Anti-allergy. And even for those, we find that people do develop rash sometimes. So, yeah.
yeah. So you would make it a little bit more colorful, as small as possible for kids, and
Yeah.
yeah, the material for some people with sensitive skin, it doesn't really make difference.
I
It's
don't think
challenging.
so.
Yeah.
Yeah. I think people with sensitive skin will not likely wear a watch, a normal watch as well. I was like that growing up. I could never wear a watch because my skin would just become irritated. And I tried different watches throughout my childhood. It never worked. So
Mm,
yeah,
yeah.
strangely, I seem to have grown out of that. I don't have a problem with it anymore.
Yeah. And what kind of advice you ended up using the wrist-worn devices? In which kind of situations you would go for the thigh-worn or for the waist-worn? Or what would you keep
Yeah, I
as a
think
criteria? Yeah.
for your smaller studies, almost like calibration type or um, laboratory type of studies, where there's short amount of period that they have to wear it. In those cases, I think it'd be okay um, to wear something on the thigh that is stuck on by a plaster. I've used Active Bell for only 2 days, and compliance was okay. I only lost two or three. It was a very small sample, of course. Um, but yeah, if you want to really, really capture sedentary behavior, mind you, I want to say, because we need that posture difference, you would think that a thigh worn monitor would be more accurate. But also with children, and I saw this during my PhD studies with children, even the active bell sometimes got it wrong, because children's postures aren't straightforward like adults. There's crawling, I watch my children sit on the couch in front of the TV. No one is sitting, like we do with our legs,
Yeah.
on the ground. I mean, feet on the ground, legs, in a vertical position. I've recently started photographing my youngest whilst reading, because he would take a book and he would read on the couch, but his legs are up in the air,
Mm,
or
yeah.
it's really difficult to get that right. I don't know what the inclinometer does with that. What is he doing if it's literally upside down? You would think he's doing a handstand.
Yeah, that's an interesting point. Yeah, and children with their movement, with their sedentary behavior, they behave differently. So probably we
Yeah.
would need like more validation studies in real life home environments where they actually sit on the sofa upside
Yeah.
down. Because if you do it in the lab, they probably
Yeah.
don't do it. Yeah.
No, exactly. Yeah. That's
Yeah.
exactly it.
So if we move to your data collection, that you were able to collect data remotely, fully remotely, what
Yes.
kind of experiences and learnings you could share?
Yeah, goodness me. The thing is, everything was new to me. I've never before done a large surveillance study like this, definitely not remotely. So I think, well, for starters, I didn't realize, what the mammoth task that is sending 800 accelerometers from my living room, exactly what that entails, but once I did it, and got through the logistics of it, it's pretty straightforward. You just have to plan really, really well. I think the biggest challenge was that lack of face-to-face contact with people. And it's not perhaps, it didn't seem like a challenge at the time, but it kind of snowballed into many other, areas. For example, if you think, typically we would go into schools, and that means that the school would have bought into the project. The teachers would know about it. The school would be, they won't confiscate the monitors. We've had one child, apparently the school confiscated the monitor and then it lost the monitor, so, and again, I'm not blaming the schools for this because they weren't really part of the study. Yes, they sent the information to the parents right in the beginning, 6 months earlier. There's no way that that message got through to the teachers who asked children to remove the monitor because it's now PE time, so, which is really unfortunate and frustrating because we lose valuable data. But if we had face-to-face contact, teachers would know what this is about, and they perhaps would not, add to the compliance issue that we already have. I think also face-to-face contact with the children, because we knew we were going to lose some monitors either in the post or with people not sending them back or losing them or anything. But if you have that face-to-face contact, and there's a face to my name, and children know they should bring it back on that day, then I think we wouldn't have lost so many monitors. Again, I don't blame the parents. We're in the middle of a pandemic, and I've had many accounts of parents telling me, oh, once I've emailed again asking for the things, saying that they've had uh, they've lost a loved one, and they've dealt with that. And of course, the last thing you want to worry about is sending that odd activity monitor back, and where is the thing, and where is the return envelope. So I think that was the biggest challenge, just a lack of the face-to-face contact that I don't think we appreciated or knew the value of beforehand. Yeah.
And you said that you didn't realize what kind of task is it to send 800 devices from your living room.
Yes.
Could you share how was it? And you said that you need to be very organized. Could you share really practical tips that how other people who are sending this amount from their
Yeah.
living room,
So
how should it be done?
yeah. So I did it a little bit different to the first and the second time point. The first time point, I initialized all monitors, and then I drove to Swansea, and my boss and I sat in a room. It was still, we weren't allowed at the time to, we had to get special permission to go onto campus. We weren't allowed to use any students. By the second time point, that was still the case, even though schools were open and everything. So I decided to do it from my home, which, yes, is a mammoth task. The first, so what we did was, of course, inside the envelope with the monitor, there's a letter explaining just the protocol, but also a return envelope with my address, a label with my address on, pre-stamped postage already, so that it's really easy for them to send it back. By the second time point, I'd learned to do just add a very small identifier in the top, in the little bottom corner there, because otherwise it means once a monitor comes back, you have to take it out and you have to find the serial number, put it into the computer to know where this comes from. Whereas if you could just have between 1 and 800 a number on there, immediately you know who this is from. So that was a very helpful tip that saved me a lot of time. Let me think. Otherwise, yeah, I asked parents to send me, a note saying um, uh, just if the child wore the thing or not, when they started, when they ended, just for, I can also just download the data and check, but that always was very helpful as well, because parents would tell me whether the child was sick at the time or whether the child, you know, broke a leg and only did 2 days or something like that. So yeah, that's basically
Mm.
the top
Yeah,
tip.
yeah. So the top tip is that put in the envelope and code that you will see right
Yes,
away
yes,
where
have an
it comes from.
identifier on the thing that comes back, so that so you don't have to open it and to put the serial number, because yeah, you're bound to make a mistake, or to it just takes more time.